A preferred provider program, also known as a PPP, is a provider healthcare network established by individual employers for treatment of their work-related injuries. From this network, employers and insurance companies determine where to send their employees for treatment of work-related injuries. PPPs are approved by the Illinois Department of Insurance, and a list of the approved networks is available on their website. PPPs went into effect immediately on June 28, 2011, when Governor Pat Quinn signed the work comp reform into law. However, the process and procedures for implementing the networks were not approved by the Illinois Department of Insurance until March 4th of this year. It applies to all claims for injuries occurring after June 28, 2011. However, the program must be in place at the time of injury. It's important for several reasons. One being, it limits the choices an employee has in selecting providers for work-related injuries. Prior to the work comp reform, the employee had the choice of 2 providers with an unlimited number of referrals from each of those providers. With the reform, they're only allowed the selection of 1 provider if they choose to seek treatment outside of the network. However, it should be noted that if an employer does not have a PPP in place, the employee still has the right to the choice of 2 physicians. It also gives the employer more direct control over the medical treatment. Prior to the reform, the employer had no control in medical treatment in regards to work-related injuries. And it also helps to ensure that treatment rendered for work-related injuries is appropriate and cost-effective with improved outcomes. You can use the PPP appointed by your carrier. However, because that network is so large, we recommend that you reduce the number to specifically fit your medical and geographical needs. If you do not reduce the number, then the employee has the right to choose any doctor within that network. And unfortunately, most networks do include some physicians who historically are not well versed in the treatment of workers' compensation injuries. We also recommend that you review your work comp carrier's PPO network and compare it with the PPP program to see if you can select doctors that are in both. This would allow you the benefit of receiving the PPO price reductions. Choose your doctors wisely. You must choose 2 providers in each area of practice based on your geographical and medical needs based on your claim history. Therefore, most employers are going to choose at least 2 occupational health providers. And for instance, if you have a history of a lot of injuries requiring treatment with an orthopedic, you need to select at least 2 orthopedic, probably 2 physical therapists, and so forth. Doctors must be located in a geographic area where the employees reside and be accessible to the employees. You should select quality physicians who practice evidence-based medicine, and they should be familiar with drug and alcohol collection and testing requirements, your job positions and the physical requirements for those positions, and the AMA guidelines for impairment ratings. Part of the work comp reform also included the addition of AMA ratings for the purpose of settlement of work comp claims. It's recommended that employees be advised as part of the hiring process. They also must be notified at the time of an injury. There are 2 forms published by the Illinois Workers' Compensation Commission that require the employee's signature and acknowledgement of their awareness of the program and their rights. You can use the forms during the hiring process, and they must be used at the time of the injury. The forms can be obtained from the Illinois Workers' Compensation Commission website, and they are available in English and Spanish. Your Horton Claim Advocate can assist you in assessing your needs and evaluating your options in implementing a PPP. Regarding the other states, each state has specific statute regarding the direction of medical treatment. Your Horton Claim Advocate can also help you in addressing each state individually and evaluating your options regarding selecting a medical provider.